Hi again. Thanks for joining us. My name is Dr. Mike Hennings, board-certified chiropractic neurologist practicing in Palm City, Florida. We have another YouTube video available today, and the topic today is epidural steroid injections. One of the reasons that I wanted to talk about epidural steroid injections is that they're very, very common, and I actually refer for epidural steroid injections quite a lot. The reason being is that back pain and radiating pain like sciatica is terribly difficult to treat. We need all the tools available at our disposal in order to offer relief. And certainly if I were in a ton of pain, I would consider an epidural steroid injection as one of the last steps prior to surgery, which was ultimately going to be the very last step available to us. I want to comment on an article that came out in Dynamic Chiropractic, which is a journal that I subscribe to. It is a very valuable journal. It's probably not something that the layperson wants to read because it's a little bit inside baseball, but it's something that I read quite frequently, so I'd recommend it for any practitioners who are out there, any doctors who are out there who are interested in kind of brushing up on current research. The article in particular that I want to comment on is by Dr. Deborah Pate. She's a board-certified chiropractic radiologist, and she brought up some interesting summaries of some of the literature that's been published on epidural steroid injections. One in particular that she commented on, and all of the literature is cited on Dynamic Chiropractic, and I'll post some of that literature below our YouTube video so that all of this is well documented, so that it's not speculative or none of it's opinion oriented. There was a recent meta-analysis of 23 randomized controlled trials, which basically they just look at the 23 trials and then take an overview of what all of them mean collectively. Over 2,000 patients were involved in this meta-analysis, and the meta-analysis found that the use of epidural steroid injections for leg pain, for sciatica specifically, was statistically insignificant, with only short-term improvements in leg pain and disability. And the short-term, what they mean by short-term is they qualify that as 2 weeks to 3 months. So not very lasting results for leg pain specifically from epidural steroid injections. Now, I have to qualify that because I refer out for epidural steroid injections. They are a valuable piece of the puzzle, and we do see some realistically optimistic results coming from epidural steroid injections for the right candidate, but they're certainly not something that should be opened with. Clearly, physical therapy, chiropractic care, massage therapy, stretching, exercise, weight loss, diet in particular are things that should be explored prior to epidural steroid injections. So I don't want to come across as bashing epidural steroid injections, but I find that they're really widely used and probably used a little bit more aggressively than they should be. And Dr. Pate brings up another interesting article. This journal article from the Journal of Bone and Joint Surgery looked at a number of other studies, and it kind of highlighted some of the side effects that are associated with epidural steroid injections. This one in particular was focused on lumbar epidural steroid injections, which is the low back. Of course, that could be used for cervical or thoracic pain as well, but this one in particular was focused on low back epidural steroid injections, which was probably the most common anyway. One of the side effects that was highlighted is high blood pressure, or high blood sugar, and the reason that that's highlighted is that epidural steroid injections, or steroids in general, elevate blood sugar. So when considering epidural steroid injections or steroids in general, we have to really be careful that we're not dealing with somebody who's diabetic or borderline diabetic, because that can definitely alter blood sugar long enough to cause some serious problems. Altering your insulin intake is usually necessary after a steroid injection, and being followed by your primary care physician or endocrinologist afterwards is certainly warranted. But constant monitoring is really encouraged, at least. But the other probably larger scale side effect that was highlighted in this journal, the Journal of Bone and Joint Surgery, involved the risk of spinal fracture after or following epidural steroid injection. The statistics from this particular journal article suggest that increased epidural steroid injections, meaning multiple epidural steroid injections, it had a direct correlation to increased risk of spinal fracture. And they said with each successive injection for epidural steroid intake, the risk of spinal fracture increased by 21%, which is obviously quite high. With multiple spinal fractures, the risk of with multiple epidural steroid injections, the risk of spinal fracture was exponentially increased, which is not a minor thing considering that most of the people, I shouldn't say most, many of the people that go for epidural steroid injections are elderly and already vulnerable to osteoporosis and compression fractures as well. So in any event, the take-home points are epidural steroid injections are a valuable tool when used for the right candidate. They do work for the right people at the right time. They should not be a go-to procedure, but certainly because back pain is rated among providers as the most difficult thing to treat, we have to use all the tools available to us. So if your doctor recommends getting an epidural steroid injection, I would heed his or her advice. I would do the literature search on it and do the research on it for yourself. Talk to some friends and family members who may have had them. Of course, your experience with that may not be the same, unfortunately. Epidural steroid injections are not a home run. They don't work for everybody. They may work one time and not another time. You may have one person that works for a week and one person that works for a lifetime, and they're just better forever. The best way to use an epidural steroid injection, however, is to utilize that brief period of lower inflammation and then go through a therapy session. When I refer for epidural steroid injections, usually I'll do it because I want to lower the local inflammation so that the therapy is more productive. And when it does, that patient usually does well. When it doesn't, that patient is usually going to surgery, unfortunately. And the last thing that we'll bring up regarding surgery is that, unfortunately, epidural steroid injections do not reduce the rate of subsequent surgery. So that's something to consider when utilizing epidural steroid injection. Again, the article from Dynamic Chiropractic was produced by Dr. Deborah Pate. She's a board-certified chiropractic radiologist. Very interesting article. Kudos to you, Dr. Pate. And I'll post the citations below the article so that she gets credit for it. Thanks very much for joining us again. If considering epidural steroid injections, certainly consult your doctor, look at the research, and don't rule it out, because back pain is terribly difficult to treat. We need all the tools available to us, and the right procedure for the right person at the right time is always the best approach. Thanks very much again, Dr. Michael Hennings. Hennings Chiropractic Neurology. Please feel free to post questions on our blog, henningschiro.com/blog, or Facebook, Hennings Chiropractic Neurology, or YouTube, of course, on the YouTube page, Hennings Chiropractic Neurology. And we'd love to be able to answer your questions on our next video blog or on YouTube. So again, feel free to contact us, 772-220-5880. And if you're in Palm City, Florida, we'd love to see you. Thanks very much.